Hello. Today is a very exciting day. I get to tell you about the first update in vaccinating our staff. As you know, the federal government has prioritized healthcare workers in the first wave to be able to get vaccinated. And last week we received our 6,000 doses, and I'm thrilled to tell you that Kathy Vasquez and Petra Smith were the first two individuals to be vaccinated. And I am so very grateful that they are leading by example to inspire the rest of us to make sure we get our vaccines. I'm also overwhelmed to tell you the amount of effort and energy it took to actually be able to do this. We have now, as of this moment in time, given over 1,200 of the first dose to our frontline workers. And again, this is a huge step forward. Now, do I think this is going to be a cure-all? Do I think this is going to change the course? It's going to do the most important thing, which is something to slow this terrible virus down. It is critical that we need to get ahead of this, and we are not. As I told you last week, our beds are full, our staff are tired, and they too are facing the same things you're facing. The positivity rate in our communities is much too high. We have to be careful, and now more than ever, through this holiday week, we really need to make very careful decisions. I need to tell you about two people. Peter Maroon is a police officer in Vineland, and Peter didn't feel well, and he thought he might have COVID. When he spoke with the emergency room and told him what he was feeling, they encouraged him to come in right away. And let me tell you, I'm so glad he did, because it turned out that Peter ended up spending 4 days with us. He was sick. He was really sick. But what he remembers the most is the kindness of the nurses who cared for him. Cassandra Volgarakis and Meg Rich took care of him. These two nurses came in and out, checking on him, monitoring him, and making sure he knew he was never alone. Closer to home, when I first got here in September, I got to meet Scott Dawson. Dr. Dawson wanted to tell me about the work he had done because of a very personal situation, talking about his stepfather who had COVID and had been very sick, spent almost a month with us. And Dr. Dawson was so moved that he became a principal investigator on one of the very important clinical trials that's going on at Mullica Hill and now at Vineland to be able to give antibodies to our patients who come in the emergency room. So passion, right? Scott had it. He saw all that went on. He put that effort to work and created opportunities for others. And then guess what? He got the virus. I saw Scott last Thursday when I was at Mullica Hill, and I couldn't believe how it had impacted him. And what Scott told me was, Amy, I was going to call you because we've got to tell people just how bad this virus is. And it is so critically important that we do the things that we can do. Wash our hands, wear our masks, stay socially distanced, and during this holiday week, stay within our bubble. That means just the people in your immediate home. I know it's hard, believe me. We are all tired of this, but look how close we are. We're hoping, as the governor's indicated, that by April, we'll be able to start vaccinating the public. We're almost there. We are in the home stretch of this. We are not going to let this virus win any more than it already has. But we have to do our part. Even after the second dose of the vaccine, we still have to wear our masks, we still have to stay socially distanced, and we still have to wash our hands. That's just a given. I want to wish all of you a very Merry Christmas, a Happy Kwanzaa, and until we see each other again, be safe and stay well. Thank you.